Hi friends, welcome back again. This is me, Dr. J. Shankar again from Unitas Hospital, Chennai, the senior consultant orthopedic surgeon. So as I told you in previous video, we just covered about the important topic called osteoarthritis, where the problem lies in the knee. Here I'm going to speak about, once again, a common problem about the pain in the back, the so-called lumbosacral spine. So these spine and back problems normally doesn't have any age limit. As I told you in the previous topics, the osteoarthritis of the knee mostly affect the old age people. But here the problem in the back or back pain can affect any age group per se. So it can start from as young age from 18 years and can go up to 70 years. So this has a very wide spectrum of presentation. As you know, the back pain presenting in each age group, say lower age group from 18 to 40 is different, from 40 to 50 is different, and from 50 to 70 is entirely different. So I'm just going to give you a broad outcome or a broad outlook how the back pain will present in various ages. Now let's take it into the commonest mode of presentation, especially a active young working age group. As you all know, now the IT industries have boomed in India for the past more than 2 to 3 decades. These 3 decades, I used to get often patients, out of 10 young patients, 5 to 6 patients present to my clinic with the acute back pain. Now what is common for this acute back pain? As you all know, the back is mainly made of solid muscles on both sides, and center we have the bone column called the spinal bone column. So this bone column will be supported on both sides by strong muscles. So as you can see, I am being sitting in my chair with an armrest like this. So this spine is helping me to maintain this posture properly. So one important problem what these young people do is they are not maintaining the posture properly. In that case, what will happen? The muscle is getting overstrained than it used to be. So in that case, what happens? The muscle is going for an acute lumbosacral strain. So first point one in the mind is the back pain presenting in this very low or underage group is because of acute lumbosacral strain. This problem can be easily managed by using a proper sitting posture what I am sitting. So you just use a proper desk table and a proper chair support with the proper armrest, and this is the position you're supposed to sit. You're not supposed to lean forward, you're not supposed to lean backward, you're not supposed to crouch back. You have to sit upright with the proper back support. Another thing is you always try to train your muscles properly. So this is the commonest mode of presentation. Next one is your lumbar disc problem. What is a disc? Basically, disc is a material between two vertebral bone which act like a lubrication and a supportive manner. Basically, it will act like a shock absorber as you see in your vehicles. So this, like say the shock absorber will give way when there is undue pressure between the spinal column. Again, all these things will occur because of overstress like sudden lifting weight, sudden bending, and just trying to pushing and pulling and overweight. As I told you, you never overdo any work beyond your limit. You try to play safe within your limit, and ultimately you have to do a proper amount of moderate exercises, say from 15 to 20 minutes of strengthening with your back muscles, which I'll be covering in the forthcoming videos. And the last one, as I told you, the age group above 40, 50 or 60, as I have told, any joint in a joint will go for a degeneration or an osteoarthritis. Same way it is affecting the knee, the spine bones will also be affected with the osteoarthritis. So that is all give pain in case of patients more than 50 to 70 years. So those patients really need some sort of a medical attention in form of getting a physiotherapy, and sometimes a few course of analgesics, sometimes even antispasmodic or muscle relaxant, along with some physical therapy here. So again, here is our hospital setup Unitas has got a wonderful physiotherapy and wonderful medicine team, which has a multidisciplinary team approach will approach the patient with a humanity care and try to bring to a proper solution. Thank you, folks.